Now, let's welcome Kiya Fox of Novant Health OB/GYN. Kiya, we are so excited to have you on the show. Thanks for joining us today.
Oh, you're welcome. Thanks for having me.
Yeah, so I know you've joined Novant Health OB/GYN. We want to learn all about that. Okay. But first, tell me some about your background, your education, where you're from.
So I'm born and raised out of Charlotte. You know, there's not a lot of North Carolinians left,
That's
I feel
right.
like. So I started out with my associates there at Central Piedmont. Knew I wanted to be a midwife, so I went to nursing. I had a teacher there say, you have to go to Frontier Nursing University. It's the best midwifery program in the U.S. So I got my bachelor's at UNC Wilmington. Right after my associates, went straight into my master's and recently graduated from there. And now here I am.
Very cool. So
Yes.
you did kind of have some time in the Wilmington area because you went to UNC Wilmington.
Well, that was online.
Online,
Yes.
Okay. And then
So-
Frontier.
And Frontier.
Where was that located?
Out of Kentucky.
Okay, very nice.
Yes.
Very nice.
I've been a labor and delivery nurse my whole career preparing.
Okay.
for
How
this.
long were you a labor and delivery nurse before you midwife?
6 years now.
6 years. Very cool.
Yes,
Very
yeah.
cool. Well, I know, you know, some folks may just not know exactly what a midwife is and what you do. So let's start there. Tell us a little bit about what it means to be a midwife.
So midwife, they say with women. We are here to serve women, you know, from puberty all the way through their entire lifespan. So we're there not only to serve during childbirth, but we're also there to serve primary care. We're also trained in primary care. We really focus on the physiological normalcy of pregnancy. They say midwives have healing hands, but we also know how to sit on our hands. We're very patient. We like to partnership with women for their health care. You know, we're there as an active team member to serve them.
Okay, very cool. What interested you? You said you always knew that you wanted to be a midwife. What interested you from the beginning? How'd you even know about it as an option?
Well, when I had my daughter, I really researched, you know, who I wanted to care for. Well, there's not a lot of midwives in North Carolina. So that was a trigger that I really needed to be there for women. But what makes me love it so much is the support, to be able to empower women, to show them how strong, you know, how amazing that they are. I mean, we have amazing bodies and we do amazing things with it. I love being there for women.
Very cool, very cool. So I think one of the things that interested me most, as you said it, is, you know, that it's not just for during childbirth. I think when I've always heard midwife,
Right.
I think childbirth. So tell a little bit more about that. You said, will you see patients of all ages?
Absolutely.
Okay.
I am there for annuals, you know, prenatals, obviously, premenopausal, postmenopausal. I mean, any, you know, gynecological concerns. You know, I'm there for her.
Okay, very cool. So
Yes.
so you're working at Novant Health OB/GYN,
Absolutely.
which is a great practice.
Yes.
And I know you've got doctors and nurse practitioners. How will you work kind of alongside that team?
So I explain it to people. You know, they say it takes a community to raise a child. Well, it takes a community to support women, especially during childbirth. You know, it's
Absolutely.
very scary for some women, and they're very vulnerable at that time. So I'll be working with the doctors and the midwives. We're a community there to support the woman, and we're just there as a team. You know, we're there to give the woman what she needs.
So if a pregnant patient, you know, let's say we've got somebody watching the show right now who is early in their pregnancy or just kind of getting started, if they specifically want to see you as a midwife, do they request you up front? Is
Yes.
that how that works?
Absolutely. When they call to schedule an appointment, they can just say, I want to see the midwife.
Gotcha. And you would see them throughout their pregnancy?
Yes, absolutely. So sometimes whether there's situations that arise, complications, or, you know, I'll collaborate with the physician, and sometimes the physician might need to see them. But for the most part, I can, you know, be there to care for them.
Very good. And then I understand that, you know, and maybe this is a misnomer even, but when I think of a midwife, I think more natural childbirth.
Yes.
Is that accurate?
So I have lots of tools in my tool belt to, you know, help support the woman.
I'm picturing your tool belt now.
Yes, a birthing ball on one side, you know.
Nice.
No. So I'm there to what we call labor sit. Like, I'm just there to support the woman, help her with position changes. But if a woman desires an epidural, whatever the woman desires, I'm there to support.
Very nice.
Yes,
Very nice. So it really is kind of no matter the choice, no matter
Absolutely.
Right. And it sounds like Novant Health, Forensic Medical Center, I know got the baby-friendly designation not too long ago, has added a lot of options for more natural childbirth. Can you talk any about those?
So we really encourage position changes. We don't have tubs, but we have open showers, so can do some hydrotherapy there. We started nitrous oxide. It's a gas used for pain, management throughout the labor process. We have monitors that they can move around freely. They're not connected to a machine that sometimes you see on television. But we really encourage the use of doulas, as a support person as well.
Nice. So tell me a little bit more about the nitrous oxide. I've heard you said it's like a gas treatment. How does that work?
So it's like a mask you put on, and you breathe it in during labor, and it doesn't take away the pain. That's a kind of a misconception, but it kind of knocks the edge off, and it does wonderful things.
Awesome. So I've heard about this peanut ball. What in the world is a peanut ball?
So it's like a yoga ball, but it's kind of squished in the middle. Looks like a peanut. There's so many different positions you can use it for. It's great if the patient's epiduralized. It keeps the diameter of the pelvis open, so it helps baby rotate down. Even if you don't have an epidural, it does the same thing. Just makes the woman more comfortable and helps the labor process.
So many options now.
Yes, so many. Yes.
And that's, I hear people talk about a birth plan.
Yes.
What's your recommendation? Birth plan or no birth plan?
It's up to the woman. But I encourage my patients to go talk to their partner, see what are your wishes during the birth, what are your wishes after the birth, so then they can write it all out, and then me and the other providers really understand what's really important to them and what matters, and so then when it comes time, we can provide them with what they want, in the safest way possible. But,
so things like whether they want an epidural or not, or expect that they're going to want that.
Yes. I mean, anything. It just kind of lines it out so we're on the same page.
Who they want in the room.
Yes.
So I think that's a big one.
Yes.
Good to talk about that beforehand.
A lot of things that were on birth plans before with the baby friendly, we do that already. Skin to skin, delayed cord clamping. Those are some important things to certain moms, and so we do that routinely now.
Okay, and the skin to skin, tell the skin to skin what exactly that is.
So as soon as the baby is born, we place the baby right on mom's chest for bonding, and it promotes breastfeeding. It feels great to hold your baby right there after all your hard work.
Absolutely. Yes. I have 3, and I can relate to that very well. Nothing more comforting right after labor than holding baby.
Yes.
The reward.
Yes.
So you said, and we talked about this a little bit, but you said that at Novant Health OB/GYN that you'll see pregnant patients as well as other patients.
Yes.
So even just regular GYN visits, if somebody wants to schedule their well visit with you, that's an option?
Absolutely.
Okay.
I am there to serve all women.
And the same kind of care plan as it would be whether you're seeing a nurse practitioner or a doctor?
Yes.
Okay, great, wonderful. Is there anything else you would like to share with our viewers to make sure they know about you or about being a midwife?
I just want them to know that I am here to serve them and create a partnership with them to serve their healthcare needs. I want to individualize my care to what each individual person needs. It's not going to be standard, care. I'm there for them.
Very cool. Well, it's such a great service added to our community. You're the first midwife in the area, so very exciting. That must feel kind of special, huh?
It is. I want to get out there and
get to know the community.
Yes, absolutely.
So as we wrap up, certainly our viewers can give a call to Novant Health OB/GYN.
Yes.
Or the website, I think, NovantHealthOBGYN.org if they want to.
Or they can look me up on my chart if they are already a patient.
Oh, perfect. Good to know. Good to know. Well, thank you so much for joining us today. We appreciate it.
Nice meeting you.
You too.